launching your prior authorization and what will likely eventually be your appeal. So it's time to go. You're ready to go. So you launch the authorization. Now maybe that one phone call made a difference, maybe it didn't. We'll see. This is where it is imperative. This prior authorization has to be labeled, again, as an exception to coverage. I cannot overstate that enough. In capital letters, we're going to flash it on the screen, exception to coverage. You are not asking them to admit that the procedure is not experimental. You are not asking them to change their policies. You are not asking them to change their formulary. You are simply asking them in your individual case for an exception to coverage. And this is imperative if you want to win. You will not win otherwise. Make sure your doctor includes mention of the length of your condition or injury that needs to be treated. For some of you, it might only be a few years that things have been going on, but for others, like those of us with EDS, it's a lifelong condition. And so that's why you might literally have decades of records, which is why it is so very important that you provided that summary and why you accumulated your records. Now these records will have to be ordered by them for free, which is why you will have had to make a list of all of your doctors that you've seen for it, the dates that you saw them, and all of that. Do not allow them an exception. Make them get all of your doctor records related to this procedure and to these injuries, no matter how extensive they are. It could be 20 years worth of records. If they are available, make them order them. This is important because any appeal that you file after this date is going to include these records. Anything that they leave out, the onus is going to be on you to make sure that they're included later. So, you're going to list out everything you think they need to include. Whether they include it or not, that's going to be up to them. And you're not going to have control over what they look at in that room, but you're going to provide them with all of that, and you're going to provide them with all of the research that you gathered on everything that you did. But again, you are not challenging the validity of the research. You're asking for an exception to coverage, and I cannot overstate that. So, the reason why this is important, the more the better, and this will set you up for them needing to consider all of your records in the future. This will make it more likely for you to win later. And that means if you do end up with the worst case scenario of an uphill battle, the more corners that they've cut, the harder it's going to be for them to justify those corners, and the easier it's going to get on you. Especially if you ended up with an attorney, which I already recommended you should have. So the appeal. These are the important steps. So first, even though you will provide the gathered research again, remember, no matter how much research you have, every time on the top of everything, even though I'm providing this research, I'm asking for an exception to coverage. This is just for informational purposes so that you can make an informed decision about the procedure that I'm requesting. Every time. Restate it, restate it, restate it. Don't worry about how redundant it might be. Restate it. You never want to give them the impression that you're challenging their policy or that you're asking them to say something is not experimental. If possible, if you happen to have had a trial of the medication or the procedure or something, you can also include that as well, especially if you've had a good result, and explain how things improved after that trial, because that can be presented as even more evidence that this is effective for you. So that is another type of evidence that can be presented in addition to the research, but again, you're asking for an exception to coverage, not to change their minds that this is experimental. Request representation immediately. And by representation, that can be you, an attorney, a family member, anyone, it doesn't matter, but you need to have representation at your appeal hearing. And that means you need to have a voice. And all people are allowed to have a voice. Ask for that representation before they even offer it or send you a letter, because sometimes they'll send you the letters too late and all that kind of stuff. Send them notification immediately that I want representation at this. If you need disability accommodations, if you need it to be over the phone, ask for that immediately, because ADA violations are taken very seriously. So those are two really important things. I personally was able to get 3 rehearings for my last procedure because they violated my representation rights, they violated my ADA rights, and they didn't consider all of my records because they didn't order them all, even though I gave them the names of all of the doctors. So these are really great ways that you can set yourself up for getting rehearing. So those are really important. So I would request it, and then if you get a letter that asks you if you want it, then re-request it. Request it as many times as possible, and make sure it's always in writing, email, and then also leave messages and do whatever you can. Document every time you've requested this type of representation. And make sure that you have that, because, anytime that they violate your rights, it sets you up for more leverage. And that's really what you want. Now, these can be done via phone. This is a good option for people who have a condition like Ehlers-Danlos syndrome, which is the kind of syndrome where you look healthier than you actually are. So I do recommend that people who look healthier and younger, like with Ehlers-Danlos syndrome, that you do your work over the phone. Unless you happen to be one of the few people with Ehlers-Danlos syndrome who look sicker than you actually are. But if you're a person who has a physical, visible disability, and you can actually get there in person, it's really hard for people to look you in the eye and deny things. So if it is possible, those are some of the times when it can be really helpful to have physical representation, but don't hurt yourself doing it. You are allowed to do these things over the phone, so do that if you need to take care of your health and take care of yourself. Contact and try to talk to a patient advocate within the insurance company over the phone and not only via email. Be very expressive about your pain, your suffering, the different problems that you're having, your desperation for surgery as an alternate option and as a last resort, and all of those kinds of things. Sometimes those things can be really helpful, and the patient advocate can really start to get involved in your hearing process and in your appeal process. Be very clear, have people reread your stuff if necessary, and get written confirmation of all of the records that they will be using for the appeal of doctors and dates. They will lie. They will tell you that they're using everything, but it doesn't mean that they are. So make sure that they are using everything that you have requested for them to use. Get written confirmation of all of the medical research you expect them to either know in advance or read before the appeal and include a lot of it. You can include that via your own things, like I used a Google Drive personally, or via copies, but send it to them and expect that they're familiar with it. This ensures that they have to have an expert in your area, because nobody can be an expert on everything. If you have a rare disorder, or if you're getting something done that's quasi-experimental, they likely won't have a prolotherapy expert, so they're either going to have to read several hundred articles within the 72 hours if you have to do an emergency appeal, or they're going to have to put an expert on the panel who knows enough about it. And if they violate either of those two things, then they've violated your patient rights and you have grounds for another appeal. And that's where having an attorney, again, can be pretty helpful. You also, though, you're including this overwhelming amount of information. One of the things you want to do, though, to be, I guess, generous or a good patient, to show them that you're also reasonable and on their side, is to provide summaries. And a summary of, 1, the research, and 2, your medical history, and 3, the reason that you need the procedure. And then say, but the research is there to give them the expertise that they need to make an informed decision. So that way, you're being reasonable in that you're providing the summary. But you're not going to let them be half-assed, so to speak, about how they're making their decision. So it's showing how active you are in your own health care, but really putting the onus on them to fill in their own gaps of knowledge. Because, they really only give you 15 minutes for this appeal, and they're making this decision pretty quickly, but this is a really good way of holding them accountable for that.